Welcome to another episode, Smiles in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me I have Kristina from Germany. So, Kristina, you are an SDA trainer,
Yeah.
right? Explain to the audience what is an SDA. What is the SDA, actually?
Thank you for being here. I'm very thankful for to stay here, and I'm very happy about that. And it's a honor for me to be the guest on your podcast today. And that's a good question. The SDA is the largest academy worldwide to offer training programs for specialized for dental professionals, and we do a lot of trainings. We held trainings 5 or 6,000 every years and teach dental professionals with the best protocol or the best treatment in prophylaxis and prevention for oral health and the therapy for periodontitis and periimplantitis, and the protocol is so minimal, invasive, and painless for the patients, and with the best clinic results. Yeah, and we or the SDA includes around 350 trainers worldwide, and all the trainers are characterized by their high quality of the education as a dental hygienist, and they have a lot of high experience with the GBT protocol and teach them with a high quality to other dental professionals to bring their on the new ways in the prophylaxis. Yeah.
And now, the most important, like, how did you become an SDA trainer? What was the journey? What motivates you to continue to be an SDA trainer? But how it happened? How it starts?
It's a long story. Within my education, I studied the dental hygiene and prevention management on the university in Cologne from 2017 until 2019. And before my study and at my study, I don't know about GBT. I don't hear from GBT. I don't know about that, and I do my conventional therapy or treatment in the prophylaxis. And after my studies, I start as an external lecturer at the university, and one day I across the GBT. So about social media, and I see it and I think, okay, let's try in the practice and show which way it is. And I started and establish it in the practice where I work as a dental hygienist. And I was so excited about the clinic results, and the feedback from my patients was so good, and I was so happy about that. And I think there must be a way, or it must be possible to teach other this. And I want to told about GBT and the results and what I do there with my patients. So many colleagues and so many dental professionals, and I contact my professor from the university, and he was my supervisor for my bachelor thesis, and I told him about that, and I asked him, and she said, okay, Kristina, I have the right thing for you. And then he put me in touch with the SDA in Munich, and and then I start my career 2021 as an SDA trainer, and it is an it is a grateful job for me. But I want to pass my own knowledge about the GBT and the dental hygiene and treatment to others, and so that they could benefit from it and grow. And that is my motivation, and I do it with so many passion.
I think that's what separates the trainer that we have from any other lecturer, because they talk by experience and the passion. And interesting is, like, I love to do the interviews for new candidates of SDA trainers. Why? Because I don't care about the CV. The CV is there, okay, but who's the person behind? He has the same values as us or not. And you fit clearly in the values, otherwise we wouldn't be here, of course. But that's what we want. We want to change dentistry, but we want to change dentistry from within. So by share our experience and to bring others to a concept that we truly believe that is ethical. And that's why the SDA grew so much. Everything started in 2006 in Germany, actually in Munich, where the Swiss Dental Academy was supposed to teach how to handle a device. And today is way more. We have a protocol. It's based on scientific evidence. We develop our own training centers. We have a hands-on program for it, and we have now multiple levels. So how you describe the daily work of an SDA trainer? How would you describe your own day as an SDA trainer?
But one thing you say, it's important for me. It's the GBT protocol. It's not marketing. It's based on a high evidence level, and that is the thing. It was important for me to establish this protocol in the practice where I work. That was important for me to say this. Every day as an SDA trainer is the same, but a little bit different. It's special, and but my follow description is often the same. And I love every day as an SDA trainer, but after I woke up and start my day on the training, I contact my practice one week before, and before I contact the practice, I contact the GBT expert from the sales. But it's so important to work together as a team, or like a team, and it was easy for me to prepare the GBT training. And I asked the GBT expert so many informations about the clinicians, about the practice, what is important to know for me. And then I contact practice and give their frame about the training day, and ask us some questions to prepare my training, or the GBT training. And then on the training day, after I'm packing all my GBT materials, I drive to the practice, and in the most of the time we are I became a warm welcome, and we start with the conversation, and then I start with prepare the theory part, and prepare the GBT materials for the theory part, set up the projector, and and then we start with the theory part for 2 hours in the training. And this is the basis for the training. But the entire team, I set up the entire team on the GBT. And after 2 hours, or in the theory part, we have so many exchange with the clinicians, and they ask some individual questions, and that's important for the clinicians. And we go this way together, and I put there in the theory part on their own GBT journey. And we started together, and this feeling is for the clinicians so important. And after the theory part, we start a little break, and we eat something and start conversations, and then we start the practical part. And this is the most important thing of the GBT training, learning by doing. And we teach in the GBT training and the practical part all about the basis, all about the airflowing, how to use it, what is the right way, piezo no pain, the perio flow, and they become an coaching for me in the live treatment, on the GBT models, on the GBT trainings kit, and it makes a lot of fun. Every training is so different, but the clinicians are so excited and so thankful that there is a trainer to come in their own practice, in their own rooms, and teach them GBT and bring them to new way, to new ways, and I'm so happy about.
Yeah,
that.
it's like you said.
Yeah.
It's the same, but it's not the same, right?
Yeah,
Every practice
yeah.
is different.
Yeah.
We met a bunch of different personalities.
Yeah.
We need to be a people's person if we
Yeah.
want to be a trainer, to talk with a lot of people, understand their challenge, and once we understand their challenge, how they will apply GBT. And the hands-on, the learn by doing is exactly that, because, okay, you have the technique, but then how to apply in your practice, and if you work in their own chair, it's just easier, because they can see that it's simple to apply and can be applied in every situation. But okay, SDA trainer, he has these beautiful moments, but what are the challenges that you feel as an SDA trainer when you go to a practice? Because there's traveling on it, there's different personalities, you have people that are really engaged and want to learn. Others, they are not so much. So we always need to have this motivational factor, like pushing people for them to be better, right? Because that's what we are trying to do, is to help them to improve. I always say that, and my team knows this is my best quality is I'm not perfect.
Yeah.
And because I'm not perfect, I'm always trying to improve. And I think most of the practice, they feel this, and most of the clinicians, they feel this. Other ones, they just feel that they know it all. I was one of those. When I got out of university, I knew it all.
Yeah.
Till the day that I didn't.
Yeah.
Right? I needed to improve. And I think all of us, we have these phases. The phase that we find out that we don't know it all, and we need to look for the answers.
Yeah, that's right. What do you say? It's I have an history from one practice. So at the moment we're so close, but the first training was so difficult for me. The practice and the clinicians have a lot of experience, and they are so straight away about the conventional treatment. And in the first training, the most of the clinicians, you sit there with this body language,
cross arms,
and look at me, and we have so many discussions, professional discussions, and they ask me so much, and I think and stand there and think, okay, that's a very big challenge today, but we made it.
Yeah, because then at the end they are like this, and they are open to the change, because they see that it's not just blah blah, but something that has some content inside.
Yeah, in the practical part, then
the practical part,
that was the thing, and all clinicians are smiling and stand there and what, and we have I have there in the last 2 years 4 follow-up trainings.
Yeah,
they booked me every time and ask when we do the next training, and and the last training was 1 month ago, and it was a blast. It was so. I show you a video. later, I came there and parking my car and go outside, and one of the clinicians stayed there and still waiting for me. And we start a conversation, and then we go inside into the practice, and it was very quiet, and that it was normally for this practice. I think, okay, what's going on here? And then we go steps, and I open the door, and then so much confetti come to me, music, they come all from the rooms, and it was so funny, and I was so thankful that we can do the 4th training in 2 years, and it was a special practice.
You create a relation, right?
Yeah.
Create a relation is like I said, we are creating a movement by doing this. People that really want to put health on dentistry are doing this. So for the listeners that are listening to us, what kind of advice do you want to give them to follow an SE trainer, or if they want to become an SE trainer in the future?
I think, but I want to say, just do it. Do it. Don't stop. You don't have to lose. We have so great opportunities in our company, and I'm so thankful that that I can do this great job every day and work in such great company with so wonderful people, with so support from the bosses, and the exchange with the other colleagues. And so come in, do it, share your knowledge, and
she, for the ones that are not seeing this on YouTube, you can see that she has a big smile in her face. So something is really good.
I love this job. This is my to share about my knowledge about the GBT. It's my passion, and it was fulfilling me every day. I love it.
So, and I hope that it keeps fulfilling you for many years. So Kristina, I really appreciate to have you on the SDA, and I think your participants of the courses do the same thing, otherwise they wouldn't throw confettis at you. No, but you create a relationship with them, and it's not just a trainer anymore, it's really a consultant relation or partnership relationship. It is really good.
That is the important thing, that you if you leave the practice, you don't say goodbye and
it's done.
You must in touch with the practice every month, every year. It's the important thing of the role as an SDA trainer.
Yeah, because if they have questions, they will come to you and they will ask the questions, right?
They need our support. They need our help as an SDA trainer. It's an important thing of the role.
So you keep a constant contact with them.
Yeah.
Okay, great. So for all you guys, you could see that SDA is something that changed lives. It changed a little bit your life. You need to be a person's person for it, and open to change, right? So like that, we establish a good relationship. So thank you so much, Kristina, for being with us, accepting to be on the podcast too. It wasn't so bad, right? No, she was a little bit nervous, but I think it went okay.
Thank you very much.
Thank you. And for all the listeners, do not forget to subscribe. You can check our episodes on YouTube, Spotify, or even Apple Podcasts, and subscribe. So see you soon.